introduce our moderator, and that's Christine Moses. Christine is a nursing program specialist in the ambulatory setting at UW Health. She describes her role as using data to modernize how nurses practice. Christine also serves as the secretary on our WNA board of directors. And so we won't ask her to take notes on this as you'll be moderating, but we will. So thank you, Christine, and I'll let you kick off. So. You can't have my tips. Oh.
Hi, everyone. Christine Moses. Aloha, right? Good morning, and I'm so glad it's toasty in here for sure. All right. As Gina said, my name is Christine Moses, and I am honored to be your moderator for our first dialogue forum. It is titled Digital Health Literacy for the Nursing Workforce and Consumers of Healthcare. I wanted Wisconsin Nurses Association to pursue digital health literacy as a topic for this year's dialogue forum, because digital health literacy is an extension of both health literacy and digital literacy. It's defined as an individual skill, opportunity, and ability to use digital technologies to access and understand health information and use it in ways to promote, maintain, and improve health quality of life. Digital health literacy is a challenge for both nurses and the patients we care for. We use technology every day, whether it's to watch the latest news, make our coffee, or even speak to loved ones across the country. I can even shut my garage door from my phone from here if I needed to. And now more than ever, technology is finding its way into the healthcare industry. The biggest example, of course, is the electronic medical record, or the EMR. But there is also automated IV pumps, there is portable monitors, there's smart beds, and there's even virtual patient monitoring, such as EICUs. Wearable devices and mobile apps are transforming healthcare as well. Blood sugar monitors and pumps are more readily available and affordable now. There are devices that help track heart rates, exercise, sleep, respirations, and more, and people are starting to take health into their own hands. Nurses also benefit from apps and devices that help them care for patients. For example, the Steth.io smartphone stethoscope is an app that allows nurses to simply use their smartphone to get breathing sounds and heart rate. In early 2020, preparations for COVID were furiously changing the healthcare landscape, not just in America, but around the world. Hospital systems began looking closely at the recommendations for decreasing COVID transmission, and chiefly among that is social distancing. By early March, the need for an immediate adaptation of our care delivery model was clear. Within weeks, clinics transformed from in-person visits to telehealth to ensure that our patients did not lose access to the health care they needed. But as often the case, hold on, thirsty. But as often the case, that those whose access was impeded to the virtual were also those who were most vulnerable to poor health outcomes related to COVID-19. The diminished accessibility to technology and the skills to even use it are based on various societal and social factors and is sometimes referred to as the digital gap or the digital divide. And it was being exposed at a very critical time in a public health crisis. I do volunteer for a program or an organization called Literacy Minnesota, and their North Star Digital Literacy Program is developed in response to it was developed in response to a need for people seeking jobs, but they lack the digital literacy skill to do that seek, to obtain and to maintain that job. So in response to the digital literacy gap brought forth with COVID and the availability of these digital therapies, North Star, along with their partner Literacy Minnesota, identified the need for digital healthcare literacy curriculum and assessment. The 5 areas of digital healthcare literacy that they are focusing on is telehealth, patient portals, the ability to find credible medical information, and health insurance basics. I do now want to move to our panel presentation and discussion. The process, as Gina sort of laid out, we will use for the presenters is they will describe what they do and how this relates to digital health literacy. Our knowledgeable panel will discuss the need for a better understanding of digital health literacy within the context of nurses' work and patient care. This also includes the nurse's perspective on the role in supporting the advancement of digital health literacy skills for nurses and consumers alike. The panel will also present information on digital health literacy from a health equity perspective and how nurses can engage as advocates. As I said before, we are increasingly aware that information literacy and digital competency is needed. Digital literacy not only facilitates effective decision-making, problem-solving, and research, but also enables nurses to have real-time access to evidence-based care at that point of care. Nursing informaticists help drive healthcare's application of technologies and bridge the gap between critical and technical perspectives. They use the integration of information technology within all aspects of nursing, including patient care, management, and education. Nursing informaticists play a pivotal role in identifying, defining, and sharing information that leads to improved patient outcomes. I am pleased to introduce 2 of our panel members who are joining us virtually from Florida. I've got Avian Grubbs and Lauren Mccray Eshafu. Both Avian and Lauren are master's prepared nursing informaticists. They have extensive experience in supporting the growth of relevant, reliable, and meaningful health information. They are the founders of a health information company called HIT Hub. Combined, they have a total of nearly 35 years of nursing practice, including 10 years experience as nursing informatics. Their experiences include project management, workflow analysis, electronic medical record implementation and the go-live support of that, data entry and analytics, and they have adjunct professor experience for RN to BSN online nursing programs. Our consumer panelist is Gwen Weaver. She is an independent consultant retired from the U.S. Department of Commerce, National Telecommunications and Information Administration. She was a broadband specialist and a federal program officer for the broadband technology opportunities. She has served as a consultant to the Digital U.S. Coalition and performed as a Truth Racial Healing and Transformation Healing Circle co-facilitator and practitioner for the American Library Association, the Association of American Colleges and Universities, and others. She serves on the board of the National Coalition for Literacy and the Durham Literacy Center. Gwen is on the executive committee of Digital Durham and on the steering committee for the Open Door Collective. She chairs the Committee on Literacy for the American Library Association and acts as an advisor to North Carolina's Digital Equity and Inclusion Collaborative. Gwen is also joining us virtually from North Carolina. We will start with Avian and Lauren as our first panelists. Please join me in welcoming both Avian and Lauren.
Thank you. Good morning, everyone. Such an honor to be invited. I am very thankful for the opportunity. My name is Lauren Mccray Eshafu. Thank you, Bree, as well. As Bree mentioned, I am a registered nurse, master's prepared nurse informaticist. I've been a nurse for about 15 years. I've been working as a nurse informaticist for 8 years, and for an additional 2 years before that as a super user in the private sector, on ortho-neuro-med-surg floor. As a super user, I had the opportunity to be more involved in our electronic health record system on a hospital-wide basis. I also had the opportunity to join many councils and be invited to many meetings that had to do with the electronic health record and health information technology. I would go to those meetings and bring back all the information to my unit where we would give our input as floor nurses. From there, I thought that, hey, what a good opportunity to look into the nursing informatics field. At the moment, I was not master's prepared. I did have a BSN. I did start a online nursing informatics program. And in the middle of my program, I decided I wanted to look into getting into the actual specialty. At that point, I did get hired as a nurse informaticist in the Department of Veterans Affairs. And I have been a nurse informaticist since. As a nurse informaticist, I have experience in project management and implementation in barcode medication administration. Also the project manager for our scheduling software. I am a liaison between the nursing service and also IT, where I have different experience with working with leadership to nurse managers to nursing assistants. So it's been a pleasure and I love what I do. I also have experience as an adjunct professor where I have taught nursing informatics to RN to BSN online students. Currently, I am co-founder of HIT Hub, which is a health information technology hub where we are trying to just bring more awareness to nurses, and not only nurses, but anyone in the healthcare field about what health information technology does and how it is very powerful in the field of healthcare. So again, thank you all for the opportunity, and I am very excited to be here.
Good morning. I am also excited to be here. My name is Avion, and I am the co-founder with Lauren for HIT Hub. My experience, I do have experience with barcode medication administration rollout like Lauren does, working in the private sector. For a hospital in Tallahassee. So with that, I had the project management side experience working with managers and the chief medical information officer, the chief nursing informatics officer, and also all the different vendors that it took to help that go live. I helped support the education for the nurses for the barcode medication administration as well. So I also got to help develop some educational pieces and tell them, you know, from the nurse's side, this is what the nurse will need for rollout. I also have telehealth, over 5 years telehealth experience, which became paramount with the pandemic. So digital health literacy is very important to me on both the consumer side and on the nurses side, because we have to be effective and efficient when we teach it. And consumers also have to know how to use it. Because with this pandemic, I mean, we all want it to end. We all want it to end. And I think it's so important, you know, that on both sides, like I said, the consumer side and on the healthcare advocate side, that we know how to just help get it done in the telehealth world. Because I also work for an insurance company. So with that, we're seeing increasing use of telehealth as opposed to office visit. So it's important that we reach a point where it could be done efficiently so that everyone benefits from it and everyone gets healthy. So again, thank you guys for allowing Lauren and I to be here. And yeah, this topic is very important to me because I definitely work in the trenches and I see how it impacts everyone.
Thank you, guys. And then is Gwen on the line as well?
I am. I'm here.
Hi, Gwen.
Good morning.
Gwen, do you want to go ahead and give a little in-depth introduction to yourself? Thanks for joining us.
Sure. My name's Gwen Weaver, and I am not a nurse. I'm not even a healthcare professional, but I would guess I would call myself a digital literacy and equity professional. And I am really happy to be here and very happy to talk about this subject, especially piggybacking on what Avian and Lauren are saying, because the need for digital skills among all of the population, whether you're at the professional level or whether you're a consumer or whether you're support staff, has just become paramount, particularly in the last year and a half, 2 years. And as technology progresses, it's going to become more and more important for everyone to have some level of digital knowledge, digital skills. So my areas of interest and expertise include digital literacy, digital skill building, and something called digital equity and inclusion. And if I may, I'm just going to take a moment to define the terms digital inclusion and digital equity, because I think it's important to have that context when we're talking about digital health literacy and digital health equity, because they parallel and they're interconnected. Digital inclusion is the set of activities necessary to ensure that all individuals and communities, including the most disadvantaged, have access to and use of information and communications technologies. It's composed of 5 elements: affordable, robust broadband service, internet-enabled devices that meet the needs of the user, access to digital literacy training, quality technical support, and applications and online content designed to enable and encourage self-sufficiency, participation, and collaboration. All of those things directly parallel what Avian was saying about the needs for consumers to be able to take advantage of online healthcare, telehealth activities, and all other aspects of health in this day and time. And so with that, I could talk for quite a long time and tell you all more about my background, but I don't want to bore you with that. I think you probably want to get on with the conversation.
Thank you, Gwen. So one of the things that we do want to discuss is how does this digital literacy as a nurse, how do we as nurses embrace digital literacy? Because I think a lot of the technologies we use, it comes with confidence and experience in using it. And we know that one of the things that can be really stressful for nurses or for anyone is not being able to do the job that you were forced with or the rate at which that job comes to you. So one of the things I want to know is, as you guys have worked with nurses who have some hesitancy in using the digital technologies available to them, even something as simple as looking up a research article to help them give the proper care to a patient, or even understand how the medical record can be less of a hindrance and more of a help to them. So I would encourage Avian and Lauren, please let me know how you have helped nurses work through this process when they're at their job.
So as the Barcode Medication Administration Coordinator, I work with LPNs, respiratory therapists who use Barcode Medication Administration, chief nurses who come to my class, managers, and registered nurses, all on different levels, some novice and some experienced. So I always start off with a PowerPoint. Well, I first ask them, do they know what Barcode Medication Administration is, or whatever the topic is? Have they had experience in it, just to see their level? And depending on what they say, I kind of direct my class in that way. So I always go through a PowerPoint and I try to use basic terminology. I always make my audience feel comfortable by letting them know at any time, please ask questions, and that opens them up and that makes them feel comfortable. Another thing that I like to do also is have them introduce themselves just to open them up. So I use basic terminology. I like to navigate the system. So once I do the PowerPoint, I go through questions, basic terminology. I navigate the system, showing them top to bottom, a thorough navigation of the system. And I like hands-on experience. That is the way I learn. I can hear something all day, but until I practice it and do hands-on experience with new systems, that is how I learn. So I think just, using basic terminology, assessing their knowledge base of what experience they have, and thoroughly showing them, and then kind of creating like a hands-on or tips and tricks tool to give them, and letting them know that I have an open door policy. So if they have questions, because I don't expect my audience to know everything just based off of a 4-hour class, but letting them know I'm here. I have, tips and tricks, or I can make how-to documents. I'm there. I can shadow you and help you, and you can always come in my office. I think that those are ways to help, staff at schools to understand
And
better.
to piggyback on Lauren, I also like to let people know where their resources are and how it can make their day more effective. I know most of us like to, when we're working, we like to work within our specific time frame. And digital literacy can impact that, whether, it's the nurse that's having the issue or you're spending time with the consumer that's having the issue. So I like to present examples of, hey, things can go a lot smoother if you use this resource. Or like Bree said, if you look up this article, maybe this can help you, work with your member, your patient, what have you, easier. And also demonstrating. I'm definitely a, do one, see one, you can do it too. So I like to demonstrate, and even something honestly as simple as using Zoom. Like, there were so many people when work from home rolled out, or when the pandemic started, that I was showing tips and tricks like, hey, you could share your screen, this is how you share your screen, this is how you can do this. And some nursing leaders didn't even realize the impact of being able to teach virtually. Like, hey, people can learn virtually. You don't have to be, in the office or in front of them. And everyone learns differently. Sure, some people are visual, some people are readers, but it can be done digitally, and we are all doing it or have done it in some form digitally. So that helps, is kind of showing, hey, it can be done. Here's where your resources are, and let's all make this work together.
I totally agree. I am a see once, do once, and maybe even teach once to know I understand how something is going. Have you guys noticed a difference in your nurses that you work with, those who are competent and confident in their use of digital literacy, and how that affects their engagement with patients? Or the opposite, those who are a little bit more hesitant to use the tools that they have? And does that ever at all disrupt how they can care for their patients, or how they even interact with them on a personal level?
Yeah, absolutely. It definitely slows them down, and it will impact the consumer at the end of the day, because I use telehealth. My company, we use telehealth programs where we can now actually, basically, you're texting the person, they're using an app, they can use an app. And if you don't know how to teach them how to use the app, and then you have to also think of different age groups. You do have to think about, our more elderly population might struggle a little more than the younger population, who's like always on the phone, always, doing something digitally. They were just born into it. So you do have to assess, the age group, or where the age group and the knowledge, it's not just age, it's also the educational level, right? So we have to take that into consideration too. But yeah, with our company using apps and having to teach people how to use the app, and it could send them reminders, it's all digital. You could text them, you could send them resources, you could give them goals. Your care plan goals can be done digitally. which is nice. So you could develop a care plan with them and be like, hey, I'm following up on this goal. We're going to talk about it every 3 weeks. But if you're a person that struggles with using the app yourself, of course, that's going to impact their experience. And we want everyone with equity. We want it to be fair. We want everyone to get the same quality experience with healthcare. So, you know, it is, we do have to find ways to all of us be on the same level playing field so that everyone gets quality healthcare.
I agree with Avion, and I do witness in my experience nurses that do have more confidence. They are able to work more seamless, you know, especially with the shortage that we're having now. It does help that staff do, you know, have the confidence and the knowledge base to use electronic health records because things are more fast paced now. We're in the pandemic, which is the unknown. So I do also see frustrations in staff that are not as computer savvy, where it kind of does take them longer in patient care. And you know, within my facility, we have 3 ways to contact us. We have what you call a Voicera, which is like a walkie-talkie, hands-free, where you can just call the person's name and get in touch, so they know that they can get in touch with me in that way. Also email or Teams, and as Avion mentioned earlier, you know, they are now more familiar with sharing their screen. That helps tremendously. Prior to the pandemic, we didn't really use Teams, we used Skype, but staff were not sharing their screens. And now, just from the touch of a button, they're able to share their screens. I can look and troubleshoot and help them. And I think that also just helps, you know, with the patient care, especially with staff that are not as confident with troubleshooting their own, you know, electronic health records.
Thank you, guys. The next question is for Gwen. How do social factors create and reproduce inequality in the behavioral skills regarding digital health technology?
Okay, let me think about that. You know, my perspective is that all social factors do have an impact here. Generally, and if you're talking from the consumer perspective, we're talking about the not just unserved and underserved. The people most impacted are unserved and underserved, which means that from a social perspective, we're talking lower income levels. We're talking folks who don't have either the time or the resources, which is a big part of it, to invest in. Many of them can't afford the technology, they can't acquire it, they can't afford the access, even if they can get the tools like an iPad or a phone or something, they can't afford the internet service that they need. There are also a lot of a number of barriers. Sometimes it's relevance. You know, you talk about people who may be hesitant to use the sorry, I just hit the wrong button and muted myself out, which means I'm not high tech either. But relevance is a big piece of it. I know, and again, listening to Lauren and Avian talking about telehealth. So for example, with telehealth, a lot of people don't even understand what it is. So some of the issues have to do with culture, they have to do with ethnicity, they have to do with trust factors, you know, things coming from an entity that they don't trust or don't understand, especially a lot of government stuff. There are just all sorts of, you know, every social issue that you can mention is both a digital divide issue and a health equity issue. And I don't know if I'm really answering the question, but I hope I'm kind of getting to it.
No, that's perfect. Just wanting to know what are some of those things that are part of our culture that really limit our consumers and our patients to have equitable care, whether they're being seen in person or through telehealth.
Right. But I mean, some of it is the many, many things that we've been hearing about in the news, you know, the many things that have caused a lot of the social unrest. It's inequities at all levels and in all sorts of things. Inequities, again, it's the wealth gap, poverty versus wealth gap. It is an educational issue in some cases. In many cases, and one of my areas of interest and work is in literacy broadly defined. And there are 43 million adults in this country who read at the 3rd grade level or below. Many of them have created coping mechanisms so that you don't know that they can't read. People will do things like say, oh, I forgot my glasses. Can you read that for me? That sort of thing. In the health area, many of these people who can't read, and lack of reading also means lack of comprehension. So the physician that you work with as a nurse tells you, I want this person to take this medication. And so you pass on that information, the medication, the dosage, and so on. They have no idea what you're talking about. They won't let you know that on the spot. Frequently, they will nod and go away. Whether or not they then have someone they can go to who will interpret it for them is another issue. But I think those are pretty concrete examples, and I've seen them in action.
I agree. I think a lot of healthcare systems tend to put E in front of a lot of things they do, like e-consent, e-visits, e-consults, e-everything. And even working with all the people who recreate these names, I get really confused sometimes because we have what we call the e-consent, where you consent to having a visit telehealth, but then also e-consent, where you're consenting to have surgery. And that can get really confusing.
Well, and not only that, can I just jump in? That's a whole nother area, and I'm sure the informatics ladies can talk about this too, and that's understanding privacy issues when it comes to data and information. So people consent to things and they have no idea to what they are consenting. How much of their privacy they're giving away, how much of their data they can or can't control on their own. And that's, again, at all levels. That's not just low-level readers, that's everybody.
Yeah, you bring up a really good point where sometimes people may be having their telehealth visit, but how do we know they're in a safe space to discuss privately their medical information?
Exactly.
So I think that's a really good point that you brought up. The other example that I have is in the clinics I work with, our nurses and our medical assistants are the ones who are ending up helping connect the patient when they're having trouble to their telehealth visit, yet they are not trained in helping people connect or get set up. And I think an example I had shared with you guys when we were discussing is a patient did call the help desk and they were told that they need to be in a different browser, but they have no idea what someone's saying when they're in a different browser. So we have to make sure that the language we use, that we understand what it is and that we can explain it to somebody in a way that helps them understand.
Can I make some suggestions on that?
Absolutely.
Because, and again, I'm really big on partnering and collaborating. And Bree, about like Literacy Minnesota, for example. One of the things that I always suggest, and this is again across the board, different disciplines, doesn't really matter. Everybody doesn't have to be an expert in everything. But what you do need is to put a little effort into finding the entities with which you can collaborate or partner, who can bring those skill sets that you don't necessarily have, so that for example, as a nurse, you have to spend a lot of time learning and understanding things that nobody else is going to understand. But there are things, as Bree just suggested, that people expect you to understand a much broader spectrum of things in lots of different disciplines. So if your organization or your entity can partner with, say, a literacy organization or a local, there are a lot of digital equity collaboratives right now around the country. If you can be involved in something like that, you then can team up with other entities whose areas of expertise are things like digital literacy training and so on. So that's always a suggestion and something to really think about.
I think that's great. And it leads us up. Was someone else going to talk?
Yeah.
Yes, I was gonna say that I agree with Gwen, and as we mentioned in our prior meeting, that it's very important to get to know who your nurse informaticists are if you have them in your facility. Not all facilities have them. I know mostly hospitals have them, but maybe not, your single-handed healthcare facilities. And if you don't have nurse informaticists, also maybe implementing a super user council. We had that in my private sector facility, and I'll be honest with you, in school, we didn't know what nurse informaticists were. Avion and I, we were nursing school classmates, and we had a basic computer class, just basic learning, Microsoft. We did not learn anything about electronic health records until we went to clinicals. And at that point, we were trying to do patient care and we were trying to learn the system. There was not a basic class. Fast forward to now, when I teach new employee orientation, I have nurses that still come up to me and ask me, how do you get into what you're doing? They don't even know that I am a nurse. I have to let them know in my introduction that I am a nurse. And I think just the assessment of, the knowledge base of nurses, even knowing that this is a specialty and how important it is a first start. And then, seeing your resources. And as Gwen said, if you can collaborate with anyone, or if you have nurse informaticists, having that team to kind of put their faces forward in the organization so that they're known, we're here to help you all with, documentation, or if there's, a template that you see needs some kind of help, let us know. We can, get together. I can look at your workflow analysis, see what your workflow is. And I will tell you, as nurse informaticists, we don't always have experience in every specialty that needs us. And that is where super users are very important, because I have implemented BCMA in our ER. I've implemented in our chemo clinic. I've implemented in our GI clinic, and right now in our ambulatory clinic. And every area that I just mentioned has a different workflow. I don't have experience in all of those areas, but just having my workflow analysis and having that one super user, and we don't have super users in our facility. However, I do ask, the nurse managers, is there a nurse that you think, could, that is very computer savvy, could be my super user? And then they're able to tell me their workflow and we work together. So I do agree that just looking at your resources, finding out who your nurse informaticist is. If you don't have one, maybe implementing a super user team with savvy, computer tech savvy nurses to kind of help. And that is, I think that's very important, just in general with where we're going with health information technology.
Absolutely.
Thank you for bringing up the super users and talking about other ways that nurse informaticists really can engage with their nurses. And I think one thing that you guys have said loud and clear is to make sure that the super users and the nurse informaticists are very made knowledgeable throughout the organization and are very visible and in the areas where those nurses work. And I don't even want to get started on standard work and everyone working a different way, because I don't think we have enough time to tackle something such as that. And you definitely led directly into the next questions or two I was going to answer or ask all of you. Is the first one was, and I think Lauren, you did a really good job explaining it, is how can this be sustained in an organization? And I think you, Avian and Lauren, brought up a lot of really good ideas, including the super user council to make decisions based on things and keeping yourself visible and available to staff as they need it. The final question that I do have for you is, and I know we've touched on some of these, so feel free to summarize, is what suggestions do you have for the Wisconsin Nurses Association to be better engaged in these efforts as an entity for nurses in Wisconsin, and how can we as this group really help push this forward, engage the nurses, and bring forth this effort that is sustainable for all the nurses?
Okay, I can go first. So one of the things that we do with one of our systems, we use AccuStaff, which is a scheduling software where prior to AccuStaff, managers would manually put in their schedules or either do it through Excel. With AccuStaff now, it actually converts the data from our Vista system and the data from our HR Smart system, and the nurses are able to electronically put in their schedules. So one of the things that we have in our contract is an annual fiscal year visit and from the vendor. And why I say that is important is because we have a high turnover rate of nursing, especially in management right now. So I think, looking at your contracts, because we do pay a lot of money for our contracts, seeing if they have fiscal year visits where they can come out and do refreshers to staff, letting them know, hey, this is, a refresher of what you may have learned, or we can go in depth in certain areas. A lot of staff and managers like to use reports for data and tracking trends, but they may not know how to do that. So I think, having fiscal year visits from your vendors, having them come out and teach you more in depth of the electronic health record, or either having, super users, councils, as I mentioned earlier, creating like how-to documents, maybe doing an assessment of your staff. What are your needs for the electronic health records, or your learning needs in general of health information technology, creating the how-to documents, creating tips and tricks, maybe even having classes. We have veterans health education, and I believe, I'm not really too familiar with it, but I believe they have classes every now and then for the patients to learn certain things with technology. And as Avion mentioned, we do have an app. I don't work on this particular app, but the app is called Annie app, and it does allow the veterans to text message and to have communication through texting. So just maybe having classes maybe once a week or monthly, to kind of help assist with learning how to use those technologies.
And Lauren, with the app, I would say on the telehealth consumer side, nurses can identify either a community resource or a caregiver that can help the people that do have that gap, whether it's educational level or poverty level, what have you, rural areas, to identify caregivers or at least a community resource that they can go to so that they can better use the telehealth mechanisms. From the nurses side, we already said it, so I'll just reiterate that my recommendation will be to, one, possibly consider adding digital health literacy in some form to the Wisconsin Board of Nursing CEU. In Florida, we have mandatory CEUs. So unsure if Wisconsin is interested in a mandatory CEU for that, but that could be a start in making sure at least every nurse is exposed to it, because we do have to keep up with our CEUs. And also the people who have a knack for the health informatics, data, that whole realm of health information technology, which encompasses digital health literacy, for those people to look into avenues of getting into teaching or learning or going that route. And if not, if you're in a leadership position or whoever is in leadership, to identify those nurses that have that knack, that have that skill, identify them and delegate and place them to where they can help others.
And I want to piggyback a little bit on what both of you have said, both Aviana and Lauren, and recommend that the association can perhaps create some kind of either a working group or whatever to gather and share best practice information about all of these areas, you know, and make it available and accessible to the membership. And again, I have a library background, so I'm really big on doing things like that. But I think that's one way to actually begin to get people working on and provide support for doing things differently. Another one is introducing things, and I think I mentioned this in our pre-meeting. I have mentioned it today, but and again, it kind of piggybacks on what Avian was saying. It's the concept of a digital navigator. There are things called health navigators, which I'm sure everybody's aware of. Digital navigators are generally folks who can help, and this is more for the consumer side, but help people find the devices, the services, you know, low-cost internet service, free or low-cost devices, training, and all of the other supports that they need to be able to take advantage of digital health activities and to be able to develop some level of digital health literacy. And then, of course, my other thing, which I've already mentioned, is building partnerships and collaborations with other organizations, libraries, and again, because library background, but also because libraries are very much engaged in providing health literacy information to the public. And so partnering with libraries and organizations like that are a way to be able to both spread the work and spread the wealth.
I
Wonderful.
want
Oh,
thing also just looking at your committees, making sure that you have a committee or a subcommittee that involves health information technology, and not just including nurses, but include somebody from your information technology team, include someone from your biomed team, include someone from lab. Lab, they use health information technology. Also, it's not just nurses. Include a pharmacist. Make sure to please include staff nurses, because they are our eyes and ears. And, you know, have those meetings. You know, if they don't have to be often, the meeting that I'm involved with is quarterly, but although we meet quarterly, we discuss a lot that has happened. And then if we have to discuss in between, you know, those quarters, we do. And I think that's important, because I know a lot of staff don't really have time, but at least if you can meet quarterly or monthly, you're able to just kind of touch bases and, you know, formulate plans as needed when it comes to health information technology, and also to see what needs are needed in, you know, the units or the areas that staff work.
at this point, we're going to open up to questions of our audience. If you are in the room here, please use the microphone that's to my right on your left to ask your question so everyone can hear. And I just want to verify, those virtually, how do we want them to ask questions? Yeah.
Somebody has their hand up
Oh, okay.
virtually.
Perfect.
Hello.
All right. Hey, I will leave this. I will let the questions from our members and participants start.
Thank you so much. My name is Roberta Pollock, and I sit on a, thank you, first of all, for your wonderful presentation. You have vast expertise in this area, and it is so interesting to listen to your counsel, your experiences, your networks. So it's so valuable, and I appreciate you being with us today. I sit on a group with the Minnesota School of Nursing called Big Data. And they have been working along with others, I think, on a unique nurse identifier. And I was just throwing that out there to see if you've heard of that. I don't think it's caught on very much in the United States, but I just was wondering if it's being discussed in any markets. We had a meeting yesterday, and part of the development, I think it's been developed, but even the major EHR programs like Epic and Cerner are not picking up on it. And I just throw that out for maybe discussion purposes.
Can you go into what the nurse identifier is with Big Data? Discussing this? interesting to hear.
Of course. I think the ANA journal, maybe a couple of months ago did, and I can share this, did have an article on it. Basically, it's an identification code that goes with the nurse wherever they go. So if they log on to technology in the system that they're employed in, if they travel, if they move, et cetera. And my understanding is that maybe perhaps physicians do have this. And so that's what it is. It's a unique identifying ID, more or less, that follows them no matter what system they're working in.
I haven't
I would like
heard.
to respond.
I do hope and wish that one day we, have interoperability, because you have patients that, travel, and sometimes they're seen in one hospital that, may use a different system or a similar system, but the nurse may not have access to their past, documentation or notes, which is very important if you want to streamline patient care. So I think that would be a really good idea to have
Absolutely.
a identifier where staff, of course, it would have to follow HIPAA protocol and privacy and security. But I think that would be a really good idea in streamlining, because as you mentioned, patients do travel, and it would be good just to
Right.
have identified that you can
So
follow.
basically on the patient side and on the nurse's side to have a unique identifier. I have not heard of it as yet, but I would not be surprised if it's coming soon.
And
Well,
I think
I will try to get a hold of the article and post it in chat if I'm able to get it today.
Thank you. That's a great question. Thank
Awesome.
you.
Thanks, Roberta. We have another question here.
No, I would like to respond to that if I may.
We've got Barb.
Yes, I'm Barbara Nichols. I'm with the Wisconsin Center for Nursing. The idea of the nurse identifier is a recommendation from the National Academy of Medicine's report 2020-2030, The Future of Nursing. And in that report, the nurse identifier is identified as a way of APRNs getting paid. And the reason, as you know, APRNs are paid through some convoluted, I can't really explain it, way in terms of the interaction with the physicians. So it is initially being discussed as a means of having APRNs who are providers being paid. That is the recommendation from the National Academy. Now, the ANA, as a discussion point universality, is discussing it in the way that you're talking about it. But in terms of the National Academy of Medicine's recommendations, as one of the things that they are saying, that in order for all people to have access and for there to be health equity, nurses are the key. And one element of the nursing area are APRNs in terms of providing care, in terms of those four categories: NPs, nurse midwives, nurse anesthetists, and clinical nurse specialists. So two components. As you push to have APRNs practice at full authority, you also want them to be paid. And the reason they are not paid, because I can't explain it because I'm not an APRN, but there's some convoluted process that you get paid through the physician. I'm probably mutilating the concept, but that is the recommendation. So what ANA is doing is raising it as a universal generic question. But what the National Academy of Medicine is saying, APRNs are critical, as well as all nurses are, for making sure that there is equity. And let's start first with getting the APRNs paid. And the way you get them paid is for them to have an identifier. So I haven't seen the AJN article, so I can't speak to that, but I can speak to the National Academy.
Thank you so much, Barbara, for that. background and explanation.
Thank you. Yes, I will definitely look into that. That is very interesting to hear.
We have another question in the room.
My name is Dr. Maureen Green, and I am an advanced practice nurse, and I've had the fortune over the last couple of years to get into telemedicine. And most recently, I'm in the process of being credentialed for telepsych. And so there's increasing avenues for us to get involved. I'm in a consortium, a national consortium that is working with Medicare and Medicaid clients under the insurance provisions to visit in the home, but also visit by telehealth. The first year I worked for this firm, it was very challenging to do telehealth. The individuals didn't have access to computers, and then they morphed that through the COVID year to actually mail computers that were ready to turn on and get onto the Google Meet platform. That was equally challenging because individuals did not want to use their Apple computer or Apple phone on a Google product. There was a lot of uncertainty about that. We had a lot of trouble getting the individuals on because they didn't understand the clicks that had to be done to get them into the meeting room. And that could take at least 20 to 25 minutes to get them on. We did use conference calls through our telephone, our smartphone, to work with our information technology department to get them on. But of course, then we're delayed in the interview. And you're restricted in terms of time because you have another client to follow. So there's a lot of logistics that you talk about in terms of general telemedicine, not only, emailing your doctor for a question or getting on for your appointment time. Those are the kind of things that are extremely strategic, and these agencies are looking for apps and dynamics to correct some of these errors rather quickly. So I see a lot of changes in that first group that I work for, and even in terms of the telemedicine that I'm currently involved in. The pay structure is actually negotiated, it's contractual, but they are utilizing credentialing. So I am credentialed with insurance companies, Medicare and Medicaid, so I am tracked for the clients that I do visit. The pay structure might come through the corporate structure into the wage relationship. So there's a lot of different ways, but I do agree with the general comment from Dr. Nichols is the fact that we should be recognized for the service we provide and not as a underling to the physician. And of course, that's our stance here at the WNA and the ANA as we continue to move forward with APN advanced practice. Equity, the state of Wisconsin, we've had a great deal of difficulty in the upper counties to get access to computers, broadband, and other avenues. We are working very strategically in Wisconsin to expand that, and we're making a great deal of headway that way. We also are doing some creative things regarding insurance mandates that we actually have to see the patient. So if you're doing telemedicine, you actually have to visualize the patient. The other thing is they can't use filters on theirs, where we might use a filter to maintain our privacy in the office, for instance, that you can't see the pictures behind me or whatever. They cannot use a filter because we have to be able to see their home in the background to be able to ascertain if there's anything that concerns us. And that's a little bit challenging because we always don't have the permissibility or the HIPAA to see widely what their home looks like. But it is an expectation that you do have audio and video at 100% of the time that you are interviewing the client. So we also have a lot of trust. We do vital signs technology-wise, ask them to do a vital sign while we're watching them. Some actually just completed it before our visit. I take that as truthful. So there's a lot of things that we have to logistically work through the process. So my comment is that, yes, we have been doing this I've been doing informatics in the hospital for over 20 years when we just had screens on the wall and we would say, yes, I gave a med, to what we're doing now in terms of epic documentation here in the state. It's huge and moving very, very quickly. But I think COVID has moved us to realize that we need this movement. And there are so many avenues for touching the clients and giving them access and ready access that we're ready and waiting for a meeting telehealth wise. So it's a very exciting time. And I'm glad that we're getting more and more involved in it.
Yes, thank you. It is a very exciting time, and COVID is putting everything in the forefront with telehealth and health information technology and the importance of it all. Thank you.
Hi, Gina Dunick Champion, Wisconsin Nurses Association Executive Director. Hello all. So glad you could be with us today. I don't know if I wonder if we could talk a little bit more in depth about the support staff for nurses. One of the things we were hearing was like our nurse assistants are, again, at their literacy level, number one, and then expectations of being able to communicate or look at the patient record, or they're in the patient room looking at the EHR, trying to, understand what the plan of care is, and other sorts of things. And any of you have experience about how you or how can we kind of get those folks who can really support? They're the ones with the patient probably a little bit more than even our nurses these days, what strategies for how do we get them try and get to their literacy level, but at the same time being able to use some of that technology or the EHR. And plus they're consumers of health as well.
So I think, as you mentioned, doing a basic assessment, I always think asking questions first, asking them, have they ever used a similar, technology in a previous practice? I ask that a lot with, BCMA, Barcode Medication Administration. And depending on what they say, if they, don't feel comfortable, I like to do one-on-one classes. So sometimes it can be intimidating if, let's just say they're a new employee and they're in a room full of, other staff that, show their confidence. That can be intimidating. I know that happens a lot in any population. So I think, maybe pulling them out, doing a one-on-one, customizing their learning, maybe asking if, let's say they're working, asking the manager, can you take them out, for 30 minutes? And, I, for example, I'll give you an example of what I did. Coming from Texas, I worked in Texas in the VA there before I went to my current position, and they had a hands-on documentation where they actually, go through every scenario that you would go through in BCMA. In my new facility, they did not have a hands-on training. So I had to customize it and make a hands-on documentation that would go through almost any scenario possible in Barcode Medication Administration. And that hands-on technology allowed my staff to actually do, the technology on the test account as if they were on the floor. And that allowed them to make errors, because you want to make the errors when you're not on the floor. So I had the nurses, and NAs don't use barcode technology, but I'm just using this as an example. Whatever it is, whether it's Cerner or Epic, if you can create like a documentation or find out from the vendor if they have a test account, that is very important. And you don't really hear that a lot. Looking to see if there's a test account where that staff member can practice and create through that documentation and any questions. So I think that's one thing. And then another is maybe creating like a standard documentation. So that is one thing that I did with the AccuStaff, which is our scheduling documentation. There are a lot of reports, a lot of different tools that you can use, and it's kind of hard to teach everyone on the same level. So, creating the hands-on how-to documents showing step-by-step in the most basic way, of how to troubleshoot something, or how to get access to, a certain technology. So I just think those are a few ways, to kind of ease the staff member that doesn't really understand, how to use it, specifically NA or someone that doesn't have the same literacy level, into learning. And then giving them practice, maybe giving them a little longer of orientation, having them, with a more experienced staff member that can, shadow them. And I think those are just a couple of ways.
And maybe refresher education too, doing small work groups or refresher education for the CNAs, because technology, we know, is always changing. Things are always gonna change. So maybe doing those refreshers, because our CNAs may need more support based off of their educational level.
Yeah, totally agree. Again, talking about the literacy levels, in some cases, you're probably going to want, again, to partner, find other organizations to work with that do adult literacy to help the staff build both their confidence and their vocabularies, because one of the things that we always have to keep in mind with all health information, whether it's instructions on how to actually provide service or what's on the consumer side, and we talked about this the other day too, is the vocabulary of health is difficult even for people with higher levels of literacy. So we always have to keep in mind how to make sure that we can present information in a clear and understandable way for people at all levels.
My name again is Maureen Green, and I am a PhD, as I mentioned before. And so I'm always interested in not only how we get in and how we document and save the data, but how we actually analyze the data after. So I've been consulted on a few of those entities regarding electronic health records. I think as nurses, we are frustrated, nursing assistants also, that we put this data in, but what do they do with it? And so there's entities of terms of, yes, these are valuable things for you to do, and we'll take just simplistically vital signs. We all know about data diving and big data mining and things like that, but we need to make sure that us as consumers understand what you've done with the data too. And that's really important for us. So I am really encouraged to see individuals, and of course our big agencies like Cerner and Epic have built a very robust data area, but maintaining a quality assurance methodology so that you can data dive into that and see if you've met your quality initiatives readily, get your percentages, make sure that you're on task for what those quality measures are. But we need to communicate that to the end user too, so that we can say, yes, you met your quality initiatives at 95% and above, whatever, so that we can be rest assured that our vital signs are valued, that our assessment is valued, that we had the specificity to have an action plan in a diagnostic category. How exciting. That's what we really need to communicate. So I think we missed that boat because we concentrate too much on how to get in, how to save, how to document, things like that, rather than saying and get that information back to our staff as managers that you really did a great job in our quality initiatives. So maybe Ivana, you can comment a little bit about that in your HIT hub.
Right. Thank you, Dr. Green. That's true, that a vital sign, I was just thinking of scenarios back when I started nursing, how like the correct vital signs on the correct person could actually save a life. Like literally save a life with putting in that data, because it was just a not a great experience with the CNA, but they were not scanning and entering the data right away. They were writing down the vitals and then going back and entering in the chart, and someone almost like bled out because it was entered erroneously. So you made a very good point in just reiterating like, hey, this is why this is done. This is why this is so important. And these are the results that can impact what you're doing.
I think it's, like you said, very important to turn that data into information. You have the numbers, but you need to convert that into information and share that with management, leadership, staff, and patients, depending on what the information is, and also having a place to keep that information. One of the things that we have started is we have a SharePoint site, but we weren't using it that much. So now what we're doing is implementing different areas in our SharePoint site for different units so that you can see that data and then also see the trends that data is, creating. And from there, and I'll give you the example, and I know I'm talking a lot about barcode medication administration, but that is my major component at my facility. I do barcode medication administration reports monthly. I do one where it breaks down each unit, where you can see the individual nurse and how many times she does not scan a wristband. And I also include respiratory with this as well. So that's one report. The other report is a trend report. So we look at the past 3 months of that report, that data. We look at trends. Is that number increasing or decreasing every month? Now, it's never going to be the same because, as we know, months have different numbers of days in it. We're having a large turnaround. But what we have done with that data is look to see, okay, is this unit, why do they have so many unable to scan? So one of the things we were able to find from that data and look into as far as information is our respiratory department. Their numbers were very large, even though their department is not as large as nursing. And one of the things we were able to find is, in this kind, I don't know if anyone works for the Department of Veterans Affairs or in the government, but there is a lot of red tape. One of the things we found is their barcode medication carts are not the same as the nursing, whereas nursing received new carts with new scanners. The respiratory department uses scanners from the IT, which they purchased their carts. They did not receive new scanners, so their scanners were failing. So if we were just doing the reports and not looking into the information and asking questions, we would continue doing the reports, continue seeing that numbers are increasing without knowing why. So it's important to take that data and ask questions. Okay, why are these numbers? And again, I always tell my staff, my reports are not to get anyone in trouble. They are to track trends, to look to see what's going on. So that was one thing that we found. Another thing was our wristbands. Our wristbands were not sturdy. We needed to look into wristbands. So we were able to see that the unable to scan wristband report was high. Look into the wristbands, do testing on the wristbands, and we found that lotions and creams would kind of what's the word I want to use? Rub off on the ink, which would create, nurses choosing unable to scan, which is a patient safety issue. So now we're in the process of looking to purchase new wristbands. So as mentioned, taking that data is not important if you don't look into the information of the data. You must take the data and use the data, look at trends, look into, ask questions, find out what's going on. Data is very important, but it has to be turned into information. So I do agree. And thank you for bringing that up.
Are there any questions in the chat or anything for me to address? No. Okay. You guys, I cannot thank you enough for joining us virtually and for all your ideas and your expertise. I do think that you have really shown us that not only literacy, but health literacy and digital health literacy is definitely something that can change how a patient is cared for and how a nurse cares for those patients. I'm speechless as how knowledgeable you all are. And I want to thank you again for joining Wisconsin Nurses Association at our digital forum for this.
Thank you for the invitation.
Thank you.
Absolutely. I do want to say one thing. I took on that North Star website that I mentioned from Literacy Minnesota. They have free assessments on there, and I took the free basic computer knowledge assessment, and I was pretty confident I was going to get 100%. Like I said, I use data and computers all the time. I only got 80 on this free assessment. So please, everyone, if you are curious in your knowledge, you can go to North Star. It's a partner of Minnesota Literacy Minnesota, and you can test not just your basic computer knowledge, but some other more advanced ones and see where you score. I was quite ashamed. I was really felt pretty confident going in. So if you need some
Bree,
humbling
let me
experience, go ahead.
let me
and take-
interrupt you, Bree. I actually have an MBA in information systems, and I didn't score 100 on it either. So,
Okay. Woo.
so don't be ashamed.
Okay, perfect. No, okay. All right. All right. I'm good. I'm good. All right, everyone. This has been a pleasure. Thank you for letting me moderate this. Oh, hold 1 minute.
A little project that we have now is what recommendations do we want to be delivered at our annual meeting in terms of what should WNA be doing specifically? And I know there's been some really good ideas, but do we want to try and summarize it so we can get it into a set of recommendations? Sorry, Christina.
No, thank you. No, sorry, needed. All right, so I'm going to start with a brief summary and let people sort of fill in the gaps. It sounds like one of the things that we wanted is to really use our nurse informaticists to their full capacity and make sure that they are completely visible and used within healthcare systems. I think some of the things we want to do is make sure that our nurses and our support staff who care for patients have the competencies and the confidence to use these digital platforms to care for the patients. And I think what Lauren and Avion brought up was making the use of the digital technologies part of their annual competence that they have to do to maintain. I do think one of the things that we do need to do is that Wisconsin Nurses Association needs to be an advocate for our consumers to ensure that they have equitable care and equitable access to all the digital tools, including and the skills to by possibly recommending and supporting the use of digital navigators. Panelists and anyone in the room, please let me know if I have missed any sort of main themes or key topics.
I think you covered it.
Oh, good. I aced that one, huh? All right. Thank you once again. Enjoy the rest of your day. Do not hesitate to reach out to Wisconsin Nurses Association if you have any bright ideas we can do to move forward with this.
I will say that I am going to send you a list of links of things that I think are useful information.
Wonderful. I appreciate it, Gwen.
Thank you
Thank
all.
you.
Thank you
Thank
all.